Hi, I'm Vincent Rajkumar. I'm happy to be here at the International Myeloma Foundation Board of Directors meeting, and I'm so happy to be speaking today with a fellow Board of Director member, Yelak Biru. Yelak,
I am Yelak Biru. I am a 22-year myeloma patient.
Yelak, when were you first diagnosed, and how did the diagnosis happen?
Huh. That's a good question. I was diagnosed very early, 3 months before my 26th birthday. My wife actually insisted that I go see a doctor because I had a cough that wouldn't go away. I went to an emergency room at that time. I was a college student, and they said I was severely anemic, but I didn't have any chest problems. I went then to an internist, and the internist looked at my numbers, and within 3 days, he diagnosed me with multiple myeloma. So I was really, really lucky to have found him and be diagnosed in a very short period of time at that young age with multiple myeloma.
You make it seem as if you're very lucky, but you must have been really shocked to learn that you had cancer at that young age and that you have to go through chemotherapy. How was that process?
My brothers would say I was young and naive and somewhat they would use the word stupid. So I really didn't understand what I was signing myself up for. And they told me I needed to take high dose, at that time VAD, vincristine, adriamycin, and dex, alternatively with Cytoxan. And I did that for 6 months. I tolerated it very well. I was in graduate school and I didn't miss a single day of school. I actually carried my VAD to class and I sat in the back of the room and finished graduate school.
Wow. You, of course, have witnessed remarkable progress in multiple myeloma. How is it from then to now? What have you seen? What has surprised you? What has impressed you?
It really is good to know there are almost close to a dozen new drugs that have been approved for the treatment of multiple myeloma. I believe 9 or so.
Okay.
When I went through that deal, I had to do high-dose chemotherapy followed by high-dose chemotherapy. But unlike most patients, I didn't do a transplant, right? At that time, that was almost a standard of care, but because I wanted to finish school and had some other priorities, I didn't go through a transplant. But right now, but I have been on many other novel therapies, if you now consider thalidomide still novel, including thalidomide, Velcade, Revlimid, Exazimib, and a couple of others.
You are an inspiration, Yelak, because you've gone through this at a young age. You've gone through many chemotherapy treatments, yet you've given back to the community. You're very active in social media and as a patient representative for ECOG, for NCI. Tell me about that. How were you able to do that?
Right. So I went to school, went to graduate school, studied data and analytics. I work as an IT director for Fortune 100 company. None of that prepared me for how I was going to be dealing with uncertainties of myeloma. What really did is the patients, advocates that have traveled this path before me.
Okay.
And I learned a lot from patients like Peter Tischler, who founded our support group, Mike Katz, who was really inspirational for many others around the country and in the world, not only myeloma patients, but cancer patients in general. I learned from a lot from them. I also now want to pay it forward and leave digital and physical footprints for others to follow.
Oh, I'm sure, because you are really inspiring so many people. You're providing messages for on all the new advances consistently on social media to patients. Patients look up to you. You're able to, through your participation in NCI and ECOG, influence the next set of clinical trials. We are here with the International Myeloma Foundations. Both of us are on the board of directors. What made you come to the International Myeloma Foundation? What do you think the IMF is about and what it can achieve?
So when Mike Katz passed away a couple of years ago, I said, what would Mike want me to do? he would want somebody to carry the torch that he has been holding for many others. I knew I couldn't do everything he did for myeloma patients, but I wanted to do something, and that's when I asked him to join the board. And I have been associated with the International Myeloma Foundation really since the beginning, when I first attended a support group 20 or so years ago. And the message and the championship that the IMF brings for the myeloma patients, and through the research network, which is the International Myeloma Working Group, which you are co-leading with Dr. Brian Dury, has made significant difference in the lives of myeloma patients now, and I'm hoping that will continue to happen in the near future and further in the future as well.
We did this interview at the end of the board meeting, and both of us are really at a very enthusiastic point right now. We feel like the IMF is going to make a significant investment in education, research, advocacy, and we are very excited about the upcoming trials and research projects. So I'm really fortunate that I could grab you and have the short interview. Before I leave you though, you may want to get the viewers your Twitter handle, because then they can follow you and see what more you have to say.
I am at North Texas MSG.
North Texas MSG. I think it's NORTH TX MSG.
Yes.
There you go. So glad to be having this interview with Yelak. This is from California in Los Angeles. We just completed the International Myeloma Foundation Board of Directors meeting. Heading home, safe travels.
Safe travels to you too.
Thank you.
Thank you.